Hi, Nadia. Welcome to the show. I'm very excited to have you on today.
Thank you. It's my pleasure, Laura.
So, it's always fun to have an international guest on. You are all the way from Switzerland
Yes.
and you're a naturopath and homeopath practicing there. So, I'd love for you to tell the audience a little bit about yourself and what you do and why we're here today.
As you said, I'm coming from Switzerland, and I started my career as I worked on a bank way back, and I did after that some marketing and project management, and I was kind of, I really thought I want to go to the source. Why are people so often ill? Why is it that people feel so unhappy or why ever? And I try to find an idea what is it cause it, what it's caused by illness. So I started to do the school. I went 6 years to school and I'm working now in my practice 16 years this year. Yes, already 16 years. And I had my children whilst I was going to school for the naturopath. And I thought first, well, it's not so difficult to treat children because I thought, well, I can treat adults, so I can certainly treat children. And I after that realized, well, it's a kind of a different thing to treat children. But also many illnesses we have as an adult lies in the root from being not well treated when you have fever or a bad cough or something when you are a child. So that's why I treat mostly children in my practice, because I saw many allergies or autoimmune system allergies, etc., is rooted by how we were treated as a child.
Fascinating. So, like, if a child got an infection, their immune system either maybe didn't have what it was needed to respond appropriately
Yeah,
to that infection,
yeah,
or they were given antibiotics incorrectly because it was viral or
exactly,
fungal versus bacterial,
exactly.
which created
Yes,
more damage. So essentially, I see this often actually with fever, where especially in the US, people are very overeager to suppress the fever in a
uh,
child.
it's the
And
same here.
it
Hmm.
is it? Okay, and it creates, a disadvantage for that child because that fever is there to serve a purpose and help the child heal appropriately. It's also related to growth spurts, right? So it's like this is a normal, natural thing that children need to go through, and we want to support them in getting through it, but not to interfere or suppress.
Yeah, that's what I often see. Suppressing a fever is, to me, one of the most damaging things you can do. Fever is always like a signal to me. I have to find the source. Why does this kid have a fever? It might be because of toothing. It might be because just a virus. Sometimes even they have fever because they are emotionally very, elevated, very excited or very sad or very angry. So fever can have so many roots and we first have to find out what causes the fever. But people often suppress the fever just by occurring and we never see why does it occur. And I see that often. And also children who have often suppressed fever, they react more often with fever. My children never had that often fever. They just had once in a while, but not every second or every third week, as I see sometimes in patients. Yes.
Oh, wow. So that's a very interesting point. When we do suppress a fever, it just is rebounding, right? That's what it
Yeah.
sounds like. It just continues to come back because it didn't get to complete its purpose, essentially, right? The fever had a purpose.
Yeah.
It was stopped. And so it comes back to finish its purpose, and then it stopped, and then it comes back to finish its purpose. So we really, that's what I love about functional medicine is we always want to identify and address the root cause. And to your point, a symptom like fever can have so many causes. I had mentioned growth spurts. When I tell parents that a growth spurt can cause a fever, they're like, what? Because that has nothing to do with infection.
Yeah,
But when a
exactly.
child grows
Hmm.
quickly,
Hmm.
their body has to break down all that material that was changed from growing, right? The body's remodeling itself. And so it's kind of heating up, burning off that extra debris, right? And processing it. And this is a normal natural process of growing for a child.
I also see fever comes back. It's like a child who asks questions, Mama, can I go outside? And the response is just no. And I see it also, fever comes again and again. It's like a question asked. And if you just never give a severe and an honest answer to your child, some children, they keep on asking, fever comes back, keep on asking, keep on asking. And sometimes, depends on the character the child has, they stop asking. And do we really like children who never ask again? We want to
Right.
have the children vivid and livid and curious. And I also see it is with fever. I like children having fever because they keep on reacting to something we don't know yet, but there is an action going on in the body. And I also see it in the characteristics of the children. Those who are very silent and never ask questions again, because mama said or daddy said often, I don't want to talk to you about this, or my answer is just no. It doesn't grow, it doesn't let grow the inner child, but also the body, as you just said.
Right. So it's really about being shut down.
Exactly. Yeah.
And so that it's not so when we're talking about suppression, it's not just, let's say, a fever. It could be that child's spirit that is feeling suppressed and shut down. And that will stay with that child for the rest of their life, right? Unless they're doing the work, inner work and all this
Yeah. Yeah.
removing limiting beliefs, all this stuff that we get to do as adults from our childhood experiences. But you're right, our childhood really shapes who we are physically, mentally, emotionally, and spiritually, especially what I see is those first 7 years of a child's life.
Oh, you're also there. That's interesting. I also see a very um the ninth year of a child is also very tricky, as you
What?
just know.
So what do you my son's going to be 9 in September, so I want
Mm.
to learn about this. So tell me what you see with 9-year-olds.
It comes from the Rudolf Steiner, his ideology. When you're turning 9, you're just crossing a path where there's no return. A child knows, once I cross this year, I will never be as young as I was. There are children, they are very happy to grow, to go outside. They're thinking about, I can be, I don't know, an artist or anything later on. But
Mhm.
there are children who like to be small. And I had my nephew, he said, I'd like to be small again.
Yeah,
But he
yeah, like
knew
a
he would never
baby.
be. Yeah. So he would
Yes.
never be small again. Even though they're still playing with their dolls or cars or whatever, they know inside this time has gone. And it can really be hard for them. So some children are in this age very sad. It's like mourning the childhood they had.
That's
And I think really
fascinating.
we have to take care. It's really important to listen to them, what they are telling us. They want to talk to us once we bring them to bed. They say, Mama, Daddy, just stay with me. I want to talk to you. They really want to know, what is my inner belief? What is my spirituality often? What do you think about death? And why is it so unfair? Some children suffer from hunger and others have war. Why is it so unfair on earth? And they really want to know, what are your deep beliefs? No.
Oh, those are big questions. Those are your bedtime
That's big
conversations.
bedtime stories, yes. But it's
Wow.
really important to really watch those children. They are no longer babies. You think you're 9 years old. You're quite. a big boy or a big girl, but it's a big step for them.
Fascinating. Well, I do see my son loves to be babied, and like we're working on him maturing, right? And being a big guy and stuffing, but he is holding on. He is like
Yeah.
definitely like likes to be cared for and nurtured and isn't like I remember myself at that age, I was much more independent. I wanted to do
Mm,
things for myself. So I do agree, like every child's a little bit different. I know some people say, women, girls are more mature, develop a little bit faster than boys, and that's obviously individual. But yeah, I think regardless if that's what's happening, still being empathetic to where their feelings are at, and I don't think it's necessarily wrong. They're not wrong feelings, right?
no, not at
Because it
all.
is a big
No.
deal, and it's probably confusing as well. And yeah,
Yeah.
it's so funny. I would think of a 9-year-old not necessarily as that. They're not even really a tween or a
No,
teenager
no,
yet,
no.
but they're crossing into that threshold.
Yeah. Yeah. It's called the Rubicon because the river where Caesar has crossed, it's a river near Rome in Italy, and he crossed the river for the fight he had. And he knew once we've crossed this river, we're not going back again. So that's the path they are crossing. That's the river they are crossing when they are around 9 years old.
Interesting. So, what else do you typically see in your practice when you're working with kids? Potentially, I mean, here in the US, we have unfortunately a lot of chronic childhood issues. A lot of it's related to our food sources, diet, exercise, lack of therefore, and just so much ultra processed food. I mean, are you seeing, you don't probably have as much of that in a smaller village in the Swiss.
Less, yes, and our children still go to school by foot or by bicycle. They can go on their own, and
Uh-huh.
it's very forced from the school, but also from the parents. So when they walk and when they ride with a bicycle, they have a little bit of exercise, which is very welcomed. And you still can do that. I mean, the streets are quite safe, and it is very common that children are. But yes, regarding I mean, the medicine industry is pushing very hard on you have to have the child vaccinated, you have to use um, ibuprofen or anything like that. That's very much pushed. And
Oh, in your
often,
country as well.
yes, yes, it's not forced in that way, but sometimes doctor says I'm not going to see you again unless your child is vaccinated.
Oh, wow. So some doctors will refuse. We see a lot of that here in the
Yeah.
US.
Yeah.
So
By
it's not
law, it's
necessarily
not given, but I mean, they can do whatever they want, right? They can say,
right.
yeah.
Yes, yeah. Do they, are the doctors getting paid by the government for their services? Or do you have private pay there, like insurance?
We have insurances, which we have to have. It's like everybody has to have to cover their insurances. And for children, you don't have actually to pay more. It's like, once you pay your insurance by year, whatever your child has, it is covered. So, which is in a way is very good. So people are not afraid to see a doctor because maybe they don't have the money. So they will go to see the doctor, which is absolutely fine. But we have some doctors which are very under pressure for like just this form of medicine, and all the rest is like, you shouldn't do that because it's not helping. And then we have younger doctors. Sometimes they are very keen about osteopathy. Sometimes they really know what it is. So it depends where you live. It depends how your doctor has been heard from patients, what helped them. Because my patients often go to see the doctor and said, well, Nadia helped me with globule or naturopathy or homeopathy. So they are very like, okay, it might help also. But
Right, because
it's
you're
like,
getting the testimonials.
exactly, it's kind of a training also. When the patients go back to their doctors and say, we found another solution, which is fine.
Mhm. So are you seeing like asthma, allergies? What about autism spectrum disorder? Like, are you seeing kids on the spectrum that are needing support?
More and more, more and more. Um, Whereas I'm not too sure whether autism is really caused by vaccines, because I have many children not vaccinated, which are very strong on the spectrum.
Like on for ADHD or more
Both,
on both? You
both.
see autism
Yeah,
and ADHD in unvaccinated children.
in
Um,
vaccinated and non-vaccinated, in
both.
both. Hmm.
Got it. So I agree, vaccines are definitely not the only cause, for
No,
sure.
it's
It
not.
could
No,
be a contributing factor, but I think generally it's probably just toxin exposure,
this
right?
might be, and stress during the pregnancy, and exactly, especially when you have your first child, you are quite under pressure to perform on your job until 2 weeks before the baby is due, which I think is really such a bad decision. But I know it's made by the government, it's made by the companies. But one of the really most important things for the baby growing in mama's womb would be a relaxed mama. And we have so many stressed pregnant women. And
Mm,
this is for me one of the main scenario, because why they have sometimes hard birth and often C-section, and also very high need babies. They scream all the time, you cannot comfort them. They are really, really on the stress side. So I think we really have to think about more how to comfort the pregnant woman.
mm.
I see so much stressed women. They move their houses. Even sometimes they get married. Sometimes you have other stressors, like your mom or dad gets ill. But compromised in this 9 months of pregnancy, this is so much stress for the mother and for the baby. And knowing that the nervous system is built during the pregnancy also,
Yes.
you just have these high need babies. I see so many high need babies, and it's so hard to see those parents then struggling. They never get a sleep. The child is only crying. This is such a hard time for young parents.
Yes. I had a baby like that here earlier today who was like, this was third visit. He's been screaming, he was screaming the entire first visit. Got a little better on the second. Today was the best. Horrible colic, gas pain, reflux. And we're working on just like you said, getting his nervous system regulated and also then helping his digestive distress because he
Yeah,
actually has
yeah,
pain from that as well, right? But, he is like mom said, he's starting to sleep a little bit better. He's crying less. So we're getting there, but it is really hard and these so exhausting for these moms and caretakers to have a crying, screaming baby. They won't sleep unless you hold them. Like
yeah,
is
yeah.
I do see that as well. And this is very intense. So I agree with you, like, the toxins can be physical or emotional during
Both, of course.
pregnancy,
Yes. Yeah,
even preconception. But let's say now you are a new mom, somebody is a new mom and they have this high needs baby, they can't rewind to go back to that pregnant period. So, I mean, I would think some homeopathy could be very valuable for the mom and the baby. Do you
yeah,
treat the dyad,
yeah,
mom and baby together in these scenarios and give them support, with the supplements?
yeah. Also, craniosacral therapy, like body-centered therapy, just to really to go into this nervous system. But also, as you said, stomach often is upside down with these children. They cannot really digest. They have colics. Sometimes they just, throw up a lot. It's such a hard time. Yes, we have to rethink the whole time around birth, I guess.
Yeah, it is really important. And I know, like where I practice, I'm right next to New York City. So I do have a lot of really ambitious, high achieving women
Of
that
course,
then
yes.
start, choose to start a family, let's say, in their late 30s, even early 40s. So they're older
Hmm.
moms at this point. They've really worked their way up the career ladder. And that's once you're up there and they really enjoy what they do, right? But they
Mhm.
also really feel called to become a mom. And it's very confusing when you're in that place of your life where you're like, I can't do both at the same level. Like you just cannot at the same time, right? You have to,
Yeah.
take a step back. I mean, and that's really hard to do, especially in the corporate world where they don't really support like, oh, you can just work part-time or you can work from home remotely. Like sometimes these are options, but a lot of times they have to really shift careers or start their own business that gives them that type of flexibility to work when they want to and how they want to versus, the 60 hours a week that they were doing for 20 years.
And also, when you worked corporate, you were kind of your mental shift was as when I'm really working hard, I'm getting somewhere. I can do. With children, it's not like that. You doing and then giving your best. It doesn't mean that your child is not crying. You can absolutely be your best mom, and maybe the outcome is not what you wish or planned. And I think this was also for me one of the most inner work I had to do. Whenever I did it right, it wasn't meant that my children weren't crying or weren't
Inner work.
upset.
Yeah. So I think also as we're having this conversation, which I love, by the way, it's fascinating. The work that I'm talking about in the corporate world and the career is coming from a very masculine place, right?
Absolutely,
And
absolutely.
and
Yeah,
women can do that and they can be very successful. But when we're talking about mothering has to be from a very feminine place. So it is really like, and like sometimes as women, we're like, oh my God, I forgot how to be feminine. I forgot how to
yeah,
to
that's
tap into
true.
my intuition and
Hmm.
trust that I know what's best for me and my child. So this is always something I'm speaking to my pregnant and new mamas is about really surrendering, like especially for birth, right? It requires so much surrender, so much internal work, going inward, really getting quiet and listening to what do we need instead of being kind of out there like, oh, you're looking at social media or you're listening to your friends talk about their birth traumas and all of that is not going to serve you as a pregnant and new mom. It's not going to help fuel and feed what you're needing, which is really just to connect to your own source. And then you're really clear, like, okay, this is what I need to do. And I think when mama's doing that, the mom's nervous system will feel safe,
Yeah,
right? And therefore
yeah,
the baby with the high needs baby you were mentioning will also feel safe and calmer because they know that mom is safe, right? If mom's not safe, then why would they feel safe, right?
of
They're a
course not.
baby,
Yeah,
right?
exactly. And that's what I really wanted to show with my book. Like you can do way more than you just think you can. You can surrender fever. You can really go about a whooping cough. Even you can go so far. Even you don't think today, but you can go further than you ever thought you could. You could with exactly as you said, you with your feminine power.
Yes. And this empowerment. So like as women, we get this information like, okay, I know I can help my child with some home remedies and they can stay home and I don't have to rush to urgent care, to get them on
Mm-hmm,
a
mm-hmm, mm-hmm.
drug or an antibiotic. But a mom who hasn't been trained in like the health sciences like us, it's nice to have a resource. So let's talk about your book that you wrote, The Natural Path. It sounds like it came out a while ago in Swiss German, which
Yes,
most of us
3 years
Americans
ago. Yeah,
cannot read. So then you recently translated it to English,
yeah,
and now it's available for sale on Amazon to buy in
exactly.
English. So what's in this book? Tell us about it.
So I'm really starting with the pregnancy also. So what are the thoughts you can have as a pregnant woman? What are our general thoughts about having a child and curing children when they have their first fever, whatever. And also it depends on the country. You sometimes you can even choose to have a home birth.
Yes.
So this is also just to know that you can often choose. You don't
There's
have to go.
options, there's
You have
choices.
you have more options than you ever think. So I really want to
100%.
show you have more options. And knowing that you could actually have your child at home gives so many different views, because you will feel more calm, more comfortable, all that. And I'm really going through the birth time also, and feeding the child. And then once I try to explain how the immune system is built in the young ages. It's not the same as you and I have nowadays. It's very vulnerable in the first years. So whenever we try to push in medicine, which is not always necessarily, the immune system makes a reaction. And as you said before, we are going towards allergies and asthma so quickly. We have children 3, 4, 5 years old, which have eczema all the time. So it's not, we think it's normal, but it's not normal. It's normalized because many children have these illnesses, but it's not something which should be in this age. And I'm really trying to explain, look, this is how the immune system reacts. And I try to show you have more than one option. You can use wraps, you can use homeopathy, you can use herbs, you can use so many other things. And sometimes you even have it in the kitchen, right?
Yes.
So you don't have to rush all the time to the doctors. And also, this is strengthen your inner, um, you really feel self-confident. And when you feel self-confident, your child can learn to be self-confident also. So it's more than just fever. It's like the general.
Yes, it's modeling empowerment for
Yeah.
our children, and we want them to feel empowered too. We want them, if they have a problem in front of them, the goal here is to teach them to be, adults that can think for themselves, that can ask questions, and they can, you know, dig and get the information that they're looking for and see their options, right? And then make a conscious choice, not out of fear, but out of education and knowledge. So I think that is so important. And children learn that best if that's what mom and dad are doing, right? If they are
Yeah,
seeing that being
exactly.
modeled, I think that is, and that's another big thing too, is, in general, we're seeing, I would say a lot of fear mongering occurring around
Mm. Hmm.
issues. Like I definitely see that, during the COVID pandemic, for example, there was a lot of fear. And I never closed my office. I was like, I'm not afraid of coronavirus. Like that is so silly to me because I trust that my immune system is strong and can support me whether I'm exposed or not. Right. So I wasn't hiding in any caves and but like a lot of people were like so afraid because that's what they were hearing on the media. They were hearing all these people were dying. There was all this hysteria, right? And I think that at the end of the day, it's really, what we know and what we believe. And if we're not really and if we're feeling, I think if you're feeling afraid of something, then
Mm.
it's interesting to be curious to kind of dig a little bit deeper, right? Go kind of a little that root cause, like, well, why am I afraid of this? Is it because I just don't know enough about it? That's okay. Now we have the internet, we have Google, we have like places and resources to give us the information we need at our fingertips.
Exactly. Yes. So I really try to put many things together. I also even have some acupuncture points where you can push when you have a sore throat, for instance, or um, a lazy stomach, not really going, can go to poo or something.
Yeah, like
So I'm
constipation.
really like try to have a book really hands on. You can do that. You can do that. You can do that. And sometimes, yes, we have red flags. We have red
Yes.
flags when you have to see the doctor. We have that. But I would say 80% you really can manage on your own.
I 100% agree with that. So the natural path is written specifically around childhood symptoms, correct?
Yes,
And how
exactly.
to support them.
Yeah,
Acupressure, homeopathy,
yeah,
herbal remedies,
yeah.
and then even like you said, remedies from our kitchen that we can make and provide. And I mean, this knowledge has been around for like hundreds or thousands of years, depending
Yeah,
on what it is, right? So none
exactly.
of this is new, but I love how you're compiling it into one source that is, available for someone to have at home to resource and be like, okay, my child has this symptom. What does that mean? How can I support them? And then to your point, when there is a red flag, it's important. Then we know, like, okay, this is something I need to go to a medical professional to get additional assistance. You know,
Exactly.
did you have a home birth, Nadia?
I didn't. I must say, when I was 5 years old, I had a severe accident. They had to cut off my whole stomach. So it was always a bit of I had a, I have a big scar, really big scar. So my midwife, she was like, we'd rather go to see the hospital. I had one not so easy birth, must say. And the second birth was like easy. That was an easy one.
Interesting. So was the cut all the way to like your uterus? Like, did you get cut
No,
that
it
deep?
was the small intestine was ripped apart, ripped apart. Yeah, it was I had a, an accident with my bicycle. I was 5. I was kind of a tomboy. I was really riding strong, and I had to have a surgery then. Yes.
Oh, I see. Oh my goodness. All right. Well, regardless, like you said, everyone has different options and choices, and not everybody like some options aren't a good fit for everybody, right? Like you're just giving an example where you consulted with a professional, a midwife, and a home birth was not a good option for you based off of your history. And like right? No big deal. Like we all
No,
find what's right for us and what's right for our child. And I think that's the other thing. Like you might have a doctor saying, like, this is what you have to do. And it's really important to say, well, I'd like to know what my other options are, right? Especially if they're only giving you one option.
yeah,
We always know
exactly.
there's more than one option.
Yeah.
And there always needs to be informed consent, which is, I know, a big thing that's been coming up in the US, specifically around vaccinations, because there
I don't know.
really isn't a lot about informed consent happening in the pediatrician's office. And now people like RFK Jr., is like demanding that this needs to happen at any medical procedure that has risk and benefits. That's what you discuss in the informed consent. You don't just say, okay, well, you're here for your baby's 2-month checkup. These are the shots that they're receiving. Like there's some conversation or informed consent with
Exactly.
that.
That's what
It's
I'm
like,
missing. Hmm.
right?
Yeah.
So this is something that they are pushing to change. And, sadly, the American Academy of Pediatricians is pushing back against that because what it means is the doctors have to spend more time with the patients to provide the informed consent. Does take time, right? And therefore they can't see as much volume, right? So it's all about time management. So I think that is a very interesting, like, well, really, what's in the best interest here? Like, I get it. The doctors deserve to get paid for their time, and patients and the parents of the patient deserve to have that time with a professional to discuss this. And vaccine hesitant parents really deserve time to have their questions answered because they've dug deep enough to have concerns around these different medical choices. And if their doctor is not able to handle their, concerns appropriately, then they're going to make a choice to not do that. Right. So,
My doctor told me, because of me, some children in Africa were dying because of measles. That's what he told me. When I said we're not vaccinating, he said
oh,
because of people like you, children are dying in Africa because of measles. And I said, well, last time I checked, in Africa they even have child soldiers, children with 7 years with the guns. I think that's a bigger problem we have. And it was quiet because that's not a discussion I really want to go. You can have a discussion about vaccinations, but it's not about blaming. It's
oh
about,
yeah, there's no blame here. And yeah, and to even that is a silly thing to even say, by the way.
of
Like,
course it is.
So, like, that is just absolutely illogical and really a very unmedical, unscientific response to your
Even,
decision
yes.
as a parent. And so, yeah, this is about just having a unemotional, this is the science, these are the facts. Like, this is the conversations that informed consent are supposed to be providing when families are making these types of decisions. So, I'm definitely excited to see that that is starting to get more awareness, at least here in the US. I think it's starting to move the needle in the correct direction. I think because of the pandemic, more and more families and parents are asking questions
Same here.
around healthcare
Same
decisions.
here. Yeah.
So that's definitely, the silver lining in all of this is that generally we're waking up from this kind of like the doctor knows all. You just do what the doctor says and you don't question it. You follow whatever, like a sheep, you follow what everyone else is doing. Everybody else is doing this, so that's what you're going to do. And people are like, well, maybe that's okay for that person to do, but I'm going to make it different. And it's not even judging, right? Like if they want to do that, that's fine. But for me and my family, I'm going to make a different choice. And that's what works for us. And why do we have to judge each other? Like, just let's respect that personal medical freedom. That's kind of where this conversation has gone. Is should be open to everyone, no matter what country you live in, no matter what your socioeconomic, standing is. Like, we just all deserve to have the right to choose what's best for us and our families.
And that's where I see a lot of benefits for the whole population about rising ADHD and autism spectrum people because they question. They question. They want to know why. They are very, people with ADHD, they are not really following the rules. Why would they? They want to know why. They keep on asking. And I think, well, maybe we say it's kind of an illness, but actually I think they are pushing the whole community towards the source. Why do we do what we do and how do we do? I see
Yeah,
really there
I
is
love
there is
that.
a silver line about these people because they are really opening up everything. Every school, they are very, schools have so many problems because of these children, but actually they are just pushing the system towards more openness. And that's really what I love about these children.
Oh my goodness, that is just fantastic. I think you're right. We want to teach our children to I have this conversation with my husband all the time to question authority. And my husband's like, except when it's me, right? Like he's like, just do what I say. I'm the father. And we have a little pushback on that because I'm like, I get it, you're the parent. I get you were raised that you always do what your parents said and you never questioned it.
Yeah,
And how can we raise our son a little bit differently where we're all respecting each other's viewpoint and perspective? And if he asks you why, it's not that he's saying, no, I'm not going to do what you're saying. He just wants to understand why you're
yeah,
asking that. And he deserves an explanation,
yeah.
right?
And
So,
that's why ADHD people are here for. I'm sure they are here for exactly these questions.
I have never heard that perspective, but it makes perfect sense to me.
Yeah,
And I do think it's valuable because in general, even if we look at 100 years ago, people were just working in factories and that, I mean, think about that. You just literally were just doing the same thing over
yeah.
and over. And that's how schools were educating children to become that
And
mentality.
factory. Yeah,
Factory worker, right? So there wasn't you would never ask questions, you would never question authority, you would just do what you're told, and if you did, then you were essentially like a criminal and you would go to jail, right? Like, you were
yeah,
really that outlier, and we can now recognize that we're different now, we don't need to, we're not raising our goal here as parents is not to raise factory workers, our goal is to raise people that are independent thinkers, that are able to have that creativity and vision to create a new world that's even better than it is now, right? And you can't do that if your mentality is just shut down to following all the rules.
yeah. So that's where I see big potential in ADHD and also the people on the spectrum because they are very, very honest. They are so honest. And they're really bringing this honesty into this population.
Right, there's
So
no filter there.
I know I don't want to say that it's easy to have a child on the spectrum, really, just, to be on the same side, but they bring qualities into this community, which we really have to adapt to it also.
Mhm. Exactly, especially because there's just like the population is growing and larger. Do you
Yeah.
have anything in the natural path around that?
No,
You
but I
don't?
have a friend and she wrote a book. I can text you afterwards. She has a book, The Intuition Compass, something like that, because about children who are highly sensitive to it. Yeah, I will text it to you so you could put it in the show notes also.
Yes, I definitely would love
Yeah,
to learn more about that. So, Nadia, I really enjoyed this conversation today. Do you have any last thoughts you want to share with the audience?
thank you very much for hosting me. And I thank the audience for listening to my Swiss German English. And no, I really want to I really want to tell the people that we can do more than we think, and we have always more options than we think.
Mm, beautiful. Well said. Thank you so much for coming on the show today.
Thank you.
Well, I hope you enjoyed today's show. If you want to learn more about Naja and her amazing book, The Natural Path, A Parent's Practical Guide to Natural and Homeopathic Remedies, please search at lulu.com to order your own copy to have at home as a wonderful reference for home remedies for your child. So you really feel empowered as a parent about how to help manage your child's symptoms and then also recognizing red flags and when you need to bring in a professional for help. In addition, if you need extra support and guidance with your own personal health journey, I am here to help. I am now offering virtual functional medicine consultations, specializing in preconception, fertility, and women's health. Please go to my website at drlaurabrayton.com. That's DRLAURABRAYTON.com and click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is a good fit for you. And also, if you love this show, please leave us a review. Go to ratethispodcast.com/well-adjusted mama and follow the simple instructions.